Member for Edmonton Strathcona, Leader of the ND Opposition.
Thank you, Mr. Speaker. In the last weeks, I've released documents showing a crisis in Alberta's emergency rooms. On one day in September, every emergency room in Calgary was so packed, critically ill patients arriving at emergency room doors were not receiving life-saving care in the way Canadian standards demand. Meanwhile, this government is telling Albertans to expect a 9% cut to services. So, to the Premier, why won't you at least admit that your plan to cut 9% out of health care will make the problems deeply, deeply more difficult?
Honourable Minister of Health.
One second. Mr. Speaker, I think it's vitally important to understand this government is committed to making sure frontline services are delivered in the most expeditious way. Our emergency departments have, in the two major cities, had some challenges. But you know something, we have some incredible people working there who are working through the challenge they face. And I know, as you know, this year has been a big problem with the flu season. I believe it's over now. It should take some pressure off the system, which allow it to be more efficient. Today we announced some changes, and we can talk about those after.
First supplemental, honourable member.
Well, thank you, Mr. Speaker. I was at that announcement, but I will say renaming existing hospital beds isn't actually opening new beds. And as for the $50 million that the health minister announced today, it kind of pales to the 9% cut. Indeed, a 5% cut to AHS is almost $1 billion, 20 times more than what you announced today. So if the Premier thinks that his announcement of 50 today can help the front line, exactly how does he expect Albertans to believe that a cut of 20 times that size will not hurt the front line?
Honourable Minister.
This takes me a bit to get up. Mr. Speaker, the intent of this government is to run an efficient, effective government. Our healthcare system is one of the best in the country. There are ways in which we can do things more efficiently and more effectively. There are metrics of which we can do more and be more efficient. The $50 million today is going to open up opportunities in several emergency rooms to begin to expand their ability to deliver services to Albertans, as well as to encourage more mental health capacity for the systems. This government is committed to helping every single individual who needs emergency help.
Final supplemental.
Well, thank you, Mr. Speaker. You know, 5 years ago, this PC government had another celebratory press conference where they announced that by 2015, they would ensure that 90% of ER patients are admitted within 8 hours. Well, the facts tell a different story. Last week, the average number of patients in Calgary and Edmonton ERs admitted within 8 hours was 34%, not 90, 34. So 5 years, and you're at 1/3 of your target. So again, to the Premier, why should Albertans trust your government to manage health care at all, let alone trust you to cut 9% without making them sicker?
The Honourable Minister of Health.
Just takes a bit of time to stand up. Mr. Speaker, today's announcement of $50 million will go a long way in helping to improve that. The Premier's announcement in the fall, of which we're beginning to build some more long-term care beds, of which we announced 750, 466 in the short term. We have improved and have put in over 300 people in those long-term care beds. As I said earlier, the Minister of Seniors is going to announce tomorrow the ASLI program. We're making tremendous strides and trying to move forward, making sure Albertans can move through our emergency system, but also through our acute care system.